Incredible guy. Yeah, but he's a nice chap. Wants me to do osteotomy on the nose, narrow nose. He's worried about the tip angle, base width. So everything that he wants, he has mentioned. My job is very easy. I only have to do what he wants. Look at this. Everything. Define edges, define jawline, his chin forward protrusion, left tilt. He also wants muscle reduction. Okay, so we pretty much went through all of this in our long consultations, and this is the list he's given me just before surgery, so I don't forget anything. Right? Hey, but listen, I think you don't need muscle reduction. What do you think? So I work on the bone, because you're not very broad there, you know. You always become very narrow. Not be nice. We never discussed about. I told you this. We don't do this.
It will be symmetrical.
We make your face symmetrical. That's already done with genioplasty, jaw angioplasty. That is symmetrical. And other thing I'm not very sure is the tip. This slightly asymmetry there, the nose. Yeah, but that is not visible much, right, from outside. I don't see much asymmetry. That will done. That will do. And then you said 100, 105 degrees, so 100 degrees finally. So little bit it will go here and there, but I understand right now it's really droopy tip. So the tip raised up, okay? One thing which you have not mentioned, which I think is of some concern now, is this point where the nose starts. There's a little depression. The first consultation you wanted that straight. Now you want me to touch that or leave it?
I want the brow ridge as it is.
So just leave this exactly. This spot don't touch.
Yeah, would it suit me if...
So what happens, this is the spot where the nose starts. Now, if you raise the tip up, the length of the nose becomes less. So if you want to increase the length of the nose, you can either do that by bringing this down, or you can take it more up. That's the two places where you can play with. So if you don't want me to touch that, and then only want me to do this, and here you're giving me a fixed angle, so pretty much I cannot play around with anything. Because you're telling me this point is fixed, this point and the angle is fixed. So it's fixed, everything is fixed. So I won't be able to, like, you know, increase the length of your nose. Is that okay?
Then you will do this.
Yeah, I think we should do a little bit if need be. Not
Brow
much.
ridge won't be too flat.
No, it won't be flat, but it can be more, there's a small ledge there, like a depression. It looks good only. But what happens if you don't take that ledge, and then if you lift the nose length will look small when you look. Then someone would think it's over projected or over corrected nasal tip. So let me just keep that thing in view for you. Rest all is fine, we went through it. Chin tilt, all that is correcting the asymmetry. So when you correct the asymmetry, projection, we discussed the projection already yesterday.
Before my
Yeah, so I think I mentioned projection, jawline, all that we've gone through.
Seven.
யார் போடணும் கட் பண்ணி
I think it's good because look at that asymmetric genioplasty. I want to explain this a while. So we've just completed a genioplasty, very interesting genioplasty because this was an advancement genioplasty, but it was an asymmetric advancement. We are correcting the asymmetry of this patient in the lower third. So this point and this point were in line right there. And look what I've done. I've moved it more towards the right of the patient. I've also removed a triangular wedge from there in order to accommodate the segment there. So it has slided a bit, so to say, towards the right side of the patient's face. I've also advanced it asymmetrically. Asymmetrically, less on this side, more on this side. And this is because the deformity he had was complex. I'm going to show you how perfectly this is settled down now. With this kind of a genioplasty, you see this is what he has. Now the two lengths are similar and we have a chin exactly in the midline, and also have this length similar to this length, to all the lengths similar. So take this pretty. Hey, did you manage to get any of the reviews? said your swelling is very minimal. Hey sister, உங்களுக்கு கூப்பிடுறீங்களா உங்க அம்மா அப்பாவை? Take rest because see, you shouldn't get hit or anything. It's all very sore now because we've done surgery right from this point to this point here.
There's swelling there.
Yeah, swelling இருக்கு. There is swelling.
Here the swelling.
Yeah. He's happy. I'm just wondering if you are.